On the behalf of my colleagues, I will present you our study, Improved Clinical Outcome of Outpatient Enhanced Recovery Hip and Knee Replacement in Comparison to Standard Inpatient Procedures, a study of patients who experience both. For this presentation, I do not declare any conflict of interest. When compared to inpatient care, outpatient programs have shown to increase bed availability, reduce length of stay, and costs. Yet, uncertainty remains regarding key outcomes and also the added benefits, if any, of developing outpatient program based on ERAS principles. The primary objective was to compare standard inpatient total joint arthroplasty program to an ERAS outpatient one regarding the first 90 days adverse event rate. Secondary objectives were pain management, opioid consumption, functional recovery, PROMs, patient satisfaction, and recommendation. This study used an ambidirectional single-subject design where patient had a standard inpatient total joint arthroplasty and had the same procedure performed contralaterally with the ERAS outpatient program. Data was collected retrospectively from patient medical record, and PROMs, patient satisfaction, and functional recovery at home was also gathered prospectively minimally 9 months after surgeries. Compared to the standard inpatient program, the ERAS outpatient program reduced complications of all grade by 51%, and also the comprehensive complication index was also significantly reduced. The first 90 days unplanned episode of care was similar in both programs at 19%. Postoperative pain was also similar between programs, however the ERAS outpatient one significantly reduced the mean opioid consumption. The ERAS outpatient program also resulted in faster functional recovery. Patients were able to walk, climb stairs, perform activities of daily living, go back to physical activities, and to work faster with this program. At the latest follow-up, PROMs were similar between programs. However, patient satisfaction regarding hospital stay, pain management, functional recovery, wound management, and patient experience was significantly improved with the ERAS outpatient program. Patients also significantly recommend more the ERAS outpatient program for a total hip and knee replacement. In conclusion, when compared to standard inpatient care, ERAS outpatient program resulted in fewer complications, similar pain control with less opioid, faster functional recovery, similar long-term PROMs, improved patient satisfaction. These results highlight the importance of implementing outpatient total joint arthroplasty program based on ERAS principles. Thank you.